Today is World Day for Safety and Health at Work. Very important day because I mean, if you're not safe, if you're not healthy enough at your working environment, how can productivity be on the rise? So it's a very significant day. That has been set aside by the World Health Organization. I mean, by the United Nations, of course, conjunction with the World Health Organization. So, the World Day for Safety and Health at Work 2021 focuses on leveraging the elements of an occupational safety and health system as set out in the promotional framework for occupational safety and health convention 2006 number 187. Now the World Day reports examines how the current crisis demonstrates the importance of strengthening these OSH, that's the occupational safety and health systems, including occupational health services at both the national and undertaking level. Now, the what do you call it? International Labour Organization will take this opportunity to raise awareness and stimulate dialogue on the importance of creating and investing in resilient OSH systems, drawing on both regional and country examples in mitigating and preventing the speed of COVID-19 at the workplace. Well, since the inception of COVID 19, the frontline workers have been the people with the most, topic. Like their conversation is more of like the forefront. The frontline workers, because they are much more at risk, exposed to the virus than other people. Now, just this little piece I'd like to read before we continue. It says, countries need to put in place sound and resilient occupational safety and health systems that would minimize the risk for everyone in the world of work in the event of future health emergencies, says the International Labour Organization in the report released. That is as early as today. So this will require investment in OSH, as I read earlier. So it's very important that whatever working space you find yourself, even if it's your own, yeah, more of like you're the proprietor or the manager or whatever, it's a self or it's a own business, you really need to put some of these things in place. Yes, it's very important, and that is why we're going to be talking about that today. But I think we're going to be looking at it from two different dimensions: the structural part and then the policy part. Okay, so we're going to be looking at that. You can join us as well with your thoughts, comments, and contributions through our Facebook page, Africa Global Radio, or on Twitter, AF Global Radio. Use the hashtag the Africa Daily Show. Our WhatsApp number also is +2332070646880.
I love Africa Global Radio.
Okay, Hafiz Gunnar is here now, back away from Chelsea mood. But Hafiz, Hafiz,
Barry,
how are you?
don't do this.
I'm not doing anything. I'm just telling you
Okay.
what I feel. That's all, and what you made me feel.
Okay.
Right. World Day for Safety and Health at Work. Yeah.
Well, the
Mm-hmm.
of safety at work, occupational safety and health.
And health, absolutely.
Yes. Now, looking at the subject, I think ideally speaking, yes. Ideally speaking, having to work for one's daily bread shouldn't expose anybody
To harm.
to harm,
Right.
exactly,
Mm.
or to expose them to life-threatening or altering situations.
Absolutely.
But we've seen that happen but then having this sort of thinking is akin to living in denial of the the occasional curveballs that life throws at us.
Right.
But then the truth is there's a danger in everything that we choose to do in
Okay.
life. There's a risk factor. There's a risk element
yeah.
to everything that we
Oh,
choose
yeah.
to do in life for whatever reason. Now, this conversation is mighty important, especially at a time where COVID is ravaging globally,
Yeah.
causing all kinds of havoc economically. That is,
Right.
and so in the formalized setting, you are seeing a lot of downsizing and people
Mm-hmm.
and retrenchments and all. Unlike the informal sector where you are seeing a lot of increase in there as a result because of it. And but then with the informal sector, you also realize that the informal sector is not so big on occupational safety and health. And so
Yeah.
if you're having a lot of people going there, then that is quite problematic.
Right.
But then even though with the formalized sectors you have that is so big on safety and health,
Okay.
there are situations or instances where we are constantly reminded, we're even sometimes reminded that, well, even in these spaces, it's not so perfect when it comes to observing safety and health.
Mm.
Now, for instance, when you talk about the basic stuff like say first aid kit or something,
Mm.
yes, there are times where you would expect some organizations to have
To
them.
have it.
Yes, even not even the organization, just on a personal level, people to have these
Mm.
things. But it turns out when the situation arises,
Mm.
you check in there and you find that some supplies are even missing in there. So
The box is empty.
exactly, in the real situation, you actually need to use it.
Mm.
It's practically useless.
Right.
Uh, Same goes for certain situations where you have fire alarms, fire extinguishers, or fire escapes and everything.
Mm-hmm.
Organizations or formal structures you expect to have these things do not. And for some businesses, you find a fire extinguisher hanging somewhere and it hasn't been
Refilled.
refilled, 10, 15 years ago
Yeah.
since business commenced.
Mm.
And you're asking what exactly is happening in there. There are even certain structures where you have CCTV installations
Mm.
that that are there not just
Not
to
functioning.
protect just the individuals or the items, but the individuals as well.
Yeah.
And when it actually comes down to it, when you want to find out if indeed they are in good working condition, you realize
They're not.
these things are just for show and
Mm.
they are broken. Yes. So there's a lot of wrong going on in the formalized structures as well,
Mm.
even though we see it. But then even but then in the informal sectors,
Yeah.
in that sector, well, you'll be lucky to have a job. And in fact, demanding anything extra is you asking to be cuddled. Some would say,
Mm.
but we've seen the effects of not observing occupational safety and health. It has led to issues of broken families, especially when we are talking about the breadwinner here.
breadwinner.
Yes, that
Yeah.
is hit in the line of duty.
Mm.
You
Mm.
have such issues. There's also the issue of child labor, where in certain instances where the children would have to be the one fending for themselves,
Yeah.
and so they would have to go out there and with all the
Involve
risk
themselves in all kinds
yes,
of.
with all the risk out there,
Mm.
and then having to fend for themselves, and sometimes not just themselves but the family this time
Mm.
because the breadwinner is incapacitated
Right.
and was hurt,
Mm.
because he was hurt in the
During
line
the
of
line of
duty.
action. of
But
duty.
then
Mm.
there's an interesting, number or numbers regarding this whole situation
Okay.
in sub-Saharan Africa. Now, quickly, now globally,
Mm.
sub-Saharan Africa alone has one of the highest work-related mortality rates. And the International Labour Organization estimates that of the 2 million annual global work-related fatalities,
Mm.
now about 20% occur in sub-Saharan Africa, with only about 12% of the global workforce. Now, you see,
20%.
yes, we are talking about 20%. So annually, we are talking about some 2 million globally in work-related fatalities.
Right. And
Now,
out of the 2 million, 20% of that
yes,
from Sub-Saharan Africa.
Africa.
Wow.
Now, you see, the thing with data is that it doesn't exactly scratch the surface. It doesn't exactly show the true nature
The true nature,
of
yeah.
it.
Mhm.
Because when you talk about generating data, you get data from the formalized structures where there's
Yeah,
a
where
record
there is that record, and yeah.
on who is doing what and whatever.
Mm.
You have that in the formalized sectors, but in the
Right.
informal, you don't really get that.
Mm.
But then if you come to the situation of Africa, I mean, it's largely agrarian. It's informal. Our economy is largely informal.
Mm.
So you have a lot of women and children in the agricultural sector.
Yep.
And even in certain cases, you have migrant workers.
Mm-hmm.
So you don't exactly get the true picture. Now, and there's this other situation of where, even pre-COVID, that is, there was the issue of home workers, people preferring to work from home.
From home, yeah.
Yes, and when they work from home, a lot of them, even in working from home, they expose themselves to certain safety hazards. Not just themselves, but their children as well. This data sometimes doesn't really capture them.
Capture these
Yes,
things,
capture
right.
some of these things. But going on, I think we'll definitely explore and find out why some of these safety issues still persist.
Right, and we would also definitely look at the structures and some of the policies that may be missing, in this particular course. But let me start with Epifania on occupational safety and health issues right here today as we mark World Day for Safety and Health at Work.
Yeah, thank you, Barry. So I think it's good. COVID-19 has actually brought a lot, taught a lot, and shown a lot, and actually bared a lot of companies and organizations, as they've realized that some of the health and safety measures they have in place is not really working or is not boding well, or let's say they don't meet the standards. You
Right.
understand?
Mm.
And with COVID-19, we've got to see that there's a lot of work to be done in certain organizations. Now, when you look at health and safety for people at work or employees, you look at those in the occupations, let's not forget stress.
Okay.
Lately, stress has become like a trend. Initially, there was a time, I mean, since the 1960s, it wasn't really well. The key thing is making sure that your employee is productive.
Yeah.
So then are you fine? You're okay? That's all. Then they can work. They're not hurt anywhere or something. But then we forget the stress that comes, the stress that actually disorients, disrupts, and ensure that they actually don't deliver as they are meant to deliver.
Okay.
And this day is actually focusing on that, the protection of mental health at work.
Mm.
Yes, it's something that the World Day for Safety and Health at Work is also looking on to, because you have quite a number of people that are actually breaking down, facing burnouts, and then some of them eventually do walk out of the jobs because the stress within is so much. And then because it's like there's no space to accommodate that, or there's not, that atmosphere has not been created where they actually have somebody they can go to, talk to, or offload some of the stress onto, then it's like, okay, I can't do this anymore. So then they find another way and then they just walk out of it. And the impact of stress in the working population is seriously important. If, let's say, somebody happens to be the breadwinner and you're in a household where you literally take care of everybody. And then, already that comes with stress because you come, everybody is demanding school fees, this,
Yeah.
that. And then you go to work and then there's stress as well on you. Now, there's going to be that inefficiency
Okay.
because the stress is already compounded in your system. You will not be able to deliver. If you're not delivering, you're not going to get the exact results the company needs. And then they're going to come back and demand why you're not bringing the results they're asking for.
Exactly.
That is also more stress. So if such a person decides to actually walk out, you know that it's going to affect a line of people that are actually depending on him or her. And what we tend to do is half of the time, we don't actually, in certain organizations, the mental health of the workers are not taken into consideration.
Okay.
Come, work, close, go. At
Right.
the end of the month, you get paid. At the end of the week or the month, I want to see this, I get that, then we're good with that. You understand? So on this day, such things are being addressed, such things are being looked at, because the magnitude of the problem is it's something that's actually having a great impact on workers' health, their safety, their well-being. But for this year, the key thing basically is looking at being prepared, because COVID-19 took everybody else by surprise. Nobody
Right.
saw it coming. So this year it's anticipate, prepare, and respond to crisis. So you
Okay.
invest in resilient occupational safety and health systems.
Okay. So yeah, invest in occupational
Safety and health systems.
systems as well. Thank you, Epi. Let me hear what Mommy has to put in there as we mark a day to ensure our safety at work. I mean, we're all workers. We're all involved in this one, aren't we?
Yeah, I mean, usually when we talk about health and safety at work,
Yeah.
we usually look at preventing injuries,
Yeah.
and making sure the workers are working in a safe environment and all of that. But like Epi said, we forget about the mental,
Right.
then the emotional as well.
Mm.
Because people come to work and they might be having trouble, they might be having things happening in the house, and they cannot talk to anyone because, I mean, I'm supposed to come to work and I'm supposed to work.
Okay.
So just like Epi said, instead of just focusing on looking at creating a safe environment for the workers to working,
Okay.
we should also encourage creating a safe environment for the workers to working emotionally, mentally, and all of that. I mean, some of the things that we can do is encouraging employers to take stretch breaks.
Okay.
I think Yasmin does that sometimes,
Yeah.
where she talks about, oh, if you're feeling stuck, you can take a walk.
Yeah. Yeah. I think she does that sometimes.
Yeah, she
herself.
does
Yeah.
herself, and
yeah.
then sometimes
Talks about it.
she
right.
comes and she's like,
Mm,
if you're feeling stuck, you can take a walk.
Yeah. Yeah.
And then I think one other thing that I believe employers can do is have an occupational clinical
Okay.
like passing an officer
Okay.
at hand
Mm.
where people can the employees can go talk to
Okay.
if something should arise,
Mm.
and then they should keep an open dialogue
Right.
in their workplaces, because that brings me back to the mental, because if there's no open dialogue in a workspace,
Mm.
how do one then employees are not able to talk to their employers when they're going through stuff
Yeah.
that will
It's
prevent
too
them from
formal.
actually doing
It's too
their work,
formal.
because you come to work and
Okay.
I have to do what's expected of me, irrespective of whatever it is going on in my life.
Right.
But if there's open dialogue, I can talk to my employer and go like,
Mm.
this is happening, this is happening. It might affect the way I work. So if I'm not able to be productive or to produce whatever it is expected of me, then you should know it is because of 1, 2, or
Maybe.
3.
Right. So I don't find myself in trouble, unexpected trouble, which I don't intend. Anyway, thank you, Mami, for sharing. The show was Africa Daily on Africa Global Radio, and we are talking about occupational and health, issues here as we mark World Day for Safety and Health at Work. Let me get back to Hafiz, and he gave us a figure of two. Is it 20 million or 2 million? 2 million, and out of that's global people who actually suffer occupational hazards and what have you. But and out of that 2 million, 20% of these cases are from Sub-Saharan Africa, and that's a cause for worry because it means there are a lot of things happening at our work spaces in Sub-Saharan Africa, and this is actually causing people not just possibly getting them out of a job, but maybe costing them their lives, and then goes a long way to affect their families and what have you as well. Hafiz,
These figures are actually mortality rates. So
these
those
are mortality rates.
exactly. So those that have been incapacitated in one way or the other in the line of duty aren't even covered
Whoa.
in this. So yes, like I
Whoa.
gave you the instances where because of the informalized nature of
Right.
the economy
Yeah.
around
Yeah.
these
Which
parts.
is a
Exactly.
dominated,
Exactly. So
one
data,
here.
gathering data on these things
Is challenging.
is challenging
Right.
in that
Okay.
respect. But then, yes, one might ask a lot of why this whole safety and health issue continue to persist. Because, I mean, this is a complex matter because it's not one thing that listening to Epi and Mod, they have classified these whole issues into emotional and very broad headings.
Yeah.
But when you go into emotions, you realize that there's a lot that goes into trying to take care of the emotional needs of your employees.
Right.
But then I just want to break down a few of the things they've mentioned. Now, when you talk about occupational safety and health, now there are instances where that make issues surrounding this whole discussion persist at the workplace. And one
Okay.
is the awareness of safety and health. Now sometimes it's difficult to even to have employees ask for something they don't even know that is due them. Okay?
Yeah.
Because there are instances where safety measures have to be installed, but some of them are too
They don't know.
timid to ask
Yeah.
or intimidated to ask. So some are not even aware of some of these safety measures that they think they should be demanding from their employers to put in place.
Right.
Now there are also organizations that start off and the whole idea is they want to, they are even aware that they are supposed to put some of these safety mechanisms in place, but then they'll tell you they are barely breaking even and putting some of these things in place. It's not exactly something they've looked at, even though they are aware that these are mechanisms they have to put in place.
Right.
And another challenge is the fact that sometimes even your colleagues, every now and then we receive training, but how much training goes into the sort of the knowledge you should have, especially in terms of delivering or first aid.
Right.
Yes, because I mean we go into the kitchen to eat every now and then.
Yeah.
Now, in a situation where say you are watching more choke on her food, what exactly do you think you're
Yeah.
able to do in the first?
I don't even have the CPR thing.
Yes, mouth to mouth, and or even in situations where someone she's unconscious or something.
Yeah. What do you do?
Exactly, you don't even know the first
thing.
Yes,
Yeah.
as to- and these are instances where you realize that the first few minutes of whatever you do as first aid counts.
Determines
Yeah,
if the person
determines
would live
or
not.
die.
Right.
Exactly.
That is true.
And a lot of the time, even it helps when your colleagues at work understand, or everyone has some sort of background to some of these things. These ways to keep each other alive, basically.
Yeah.
And there are also instances where you have issues of gender discrimination and cultural norms that exist in certain workspaces
Right.
that makes life difficult, especially for young women, those that are looking to break some sort of glass ceiling.
Yeah.
Yes, I think, and even reading up some of these things, I think I chanced on the works of the story of Flight Lieutenant Gunjan Saxena, the first female pilot in India,
Pilots.
and
Mm-hmm.
everything she had to do, and all the hurdles she had to face,
Right.
yes, in the Air Force base in India, and everything she had to go through to be able to become the person she was. And largely, and lastly, there's also the issue of certain unique challenges, emerging challenges, I would say. If you talk about something like that is psychological, you're talking about your HIV status.
Okay.
Yes, when you talk about violence and the fact that you're not safe at work is because of the fact that maybe sometimes health-wise, you are aware that you have a positive HIV status.
Right.
Somehow your colleagues at work know about this.
Okay.
Yes, there are times you face certain levels of violence or certain levels of intimidation, certain behaviors that aren't exactly good for you health-wise.
Mm.
And so, what are the measures put in place by the organization to, help cushion you against some of, these behaviors or these backlashes that
Right.
you are going to be exposed to when,
Mm.
your status is made known to
Yeah.
to your colleagues. So
Mm.
largely, it's broad based. Okay,
Right.
like you made mention, there are structures
Mm-hmm. Mm-hmm.
when we talk about safety and health.
Mm.
There are structures you would need to put in place. Talk about the extinguishers. Talk about
Oh yeah.
these are physical structures,
Mm-hmm.
but sometimes policy wise you would have to put in place structures, certain structures as well.
Right.
Now even in structures, I think if you mention certain countries, they'll tell you that as part of the structures they even put up physically, they need to make room for bomb shelters and everything.
Oh yeah.
Yes.
Yeah.
Because of the situation, a place like
The sit-
Israel.
exactly.
Yes, bomb shelters are very common. Thankfully, Ghana here is not
Yeah.
something
Right.
we would even consider in
Just
putting up a structure.
knock out and we are good to go. Just, guy, behave yourself, man.
So yes, and then
Right.
policy-wise, yes, you would need to constantly,
Mm.
educate your people, let them understand what happens.
Mm.
I mean, when you talk about safety and health, I remember one time this whole discussion came up around sports, and the whole conversation was how in this second division and the third division,
Yeah.
where there are no ambulances stationed, so you have kids that are playing in the scorching sun, and when they
Yeah.
pass out,
Someone suddenly collapses.
the first thing you see anybody run onto
a
the pitch
sachet
is a
water.
sachet water.
How can you bring that
So
person?
you get consciousness and you see that you are drenched because some way somehow someone thought it's a good idea to pour a gallon of water on you.
I think that has been the norm, for so long, and they're just repeating and making sure that they've tried it and it somehow it worked. So
You wake up and you're wet.
yeah, exactly. You start wondering. Well, but I think it's a very interesting conversation and a good one for that matter, especially with the issue of structures and policies and all of that. So I have this friend whom I spoke to over the weekend about some of these things, and this person is working with an important organization, in the country actually, that is very, very much connected to the, to national, work and everything. And I was surprised when he made mention of the fact that, just anything happen, they would have to bear the costs at that time before they bring all the necessary documentations to prove that this. It got me wondering. I'm like, really?
Well, what organization are you working for?
I just don't want to mention names, but I was actually surprised, when he even mentioned the institution. I'm like, even that, not to talk about, a private individual, because at least he owned his business. It's his own business, so nobody would at least get to him and then start asking questions on why didn't you provide this and why didn't you provide. Because at the end of the day, the bigger organizations, some of them are even not actually making these things available to their employees.
That's the thing.
Very worrying.
When you talk about some of these things, it's just something that is around. You don't even have to
Look far.
Look far. It's just around you, because especially with the women's bit, because there are times where you visit certain places and you have, women struggle with changing rooms, and they're supposed to have theirs, but
Yeah.
some way somehow
Mm.
they share theirs with the men.
With the men, right.
And even the ones that do have, their own changing rooms, you realize it's not so conducive. I mean, it's a peeping tom's paradise. They come around and they can see all kinds of.
Are we, is it, I don't know. Is it about, what do you call it? Just about profit oriented, you know, thing. Let's just work, make the money, pay you, and then you're gone. And should anything happen to you, yeah, we'll compensate you, and then we get another person to replace.
Employers are always looking to cut costs. So if not installing these measures would cut costs, a lot of them would do it.
I just feel,
But
yeah,
exactly.
yeah.
So they would do it. But but I think largely it's due to the fact that there aren't also compliance mechanisms.
Mm,
Because if you want to set up an occupational safety and health agency,
right.
you would need, certain people with certain, a myriad of technical know-how.
Yeah.
Because, for instance, you can't have a civilian walk into, say, a military base to try to do some sort
To
of,
allocate what
some
and-
assessment
yeah.
when he's never been in the line of fire.
Mm.
Okay, so you would need an agency
Some
like
technical
that.
expertise.
Exactly, that
Mm.
has a lot of technical expertise. Sometimes even when they don't have the personnel, they would have to, employ the services of some of these agencies that are also, related to whatever agency they are investigating,
Yeah,
so
yeah.
they can do a better job of it.
Mm.
That's the only way you can have that. But
Right.
I mean, compliance mechanisms are.
Mm.
I would say there's little compliance mechanism. I'll say they are non-existent, really.
Right.
So,
Okay, thank you, Hafiz. The show is Africa Daily on Africa Global Radio, and we're still marking World Day for Safety and Health at Work. It's all about the safetiness of the work of the employee, and how they are able to find themselves in a very conducive working environment, which in turn actually increases, productivity at the end of the day. Let me get back to Epi on this particular topic. Epi,
Barry.
yeah, being safe at work and ensuring that actually you have that conducive space. Unfortunately, sometimes that's not the case in some spaces. Very, very, very sad.
I think first off, it's actually being aware of the thing. The certain organizations you're working in, the water is spilled on the floor and it's not actually wiped off immediately. It's actually seen as a hazard. Because if someone literally walks on that and slips,
Yeah.
the person could actually, crack
yeah.
their skull, break an arm, break a leg. But I think we're used to the fact that, there's just water on the floor. We'll clean it, we'll clean it, we'll clean
Yeah.
it. There's that agency is not really attached to setting things.
Right.
We don't even identify or place in setting boxes or say, this is a hazard, this is a risk, this is something that is a broken stairway, or probably a part of the road that cannot be assessed, or there's something is messed up, it's faulty, so don't use this place, don't use this, don't. Fixing it is not seen as a priority. Once there's another option, just use this one, forget this one, ignore this one. Until somebody actually gets endangered in that state, then we actually see that it's important. And like I mentioned earlier, COVID-19 has actually, proved a lot and seen that a lot has to be done, especially when you're looking at the health and social care, you're looking at emergency. Certain sectors, have been affected, and they've actually seen that a lot can go into it. Now, if you're looking at it, particularly some healthcare workers have been vulnerable to the risk of infection. And ever since, the outbreak of the crisis, you've had 7,000 health workers that have died since the outbreak. And out of that also, you literally still have here 136 million of them that are like social health and social care workers who are at the risk of contracting the COVID-19 through work.
Right.
So we need to make sure we put it in a
Yeah.
lot of places. We know that there were certain hospitals that, I think it was in, I've forgotten the African country, but the doctors and nurses literally went on strike because they didn't even have PPEs.
Okay.
And they were meant to be dealing with COVID-19 patients. They were meant to be taking care of the people who had contracted the virus. But they had not even been supplied with PPEs in the first place. So then they are not even being protected. How do they take care of those? So whilst in the line of duty, whilst they're actually doing their jobs, they are putting themselves at risk, which is not right. I believe employers out there should start looking out for the basic. Like Hafiz said, do we have a first aid box? Does this company have a first aid box? That company have first aid? What if something is happening to me? What if something happens? What
Right.
do we do?
I think it's something that I think even the employees should be
You
should
see,
should be
that-
should be
that's
aware of.
yeah, but that's what he was
But
also saying. Sometimes
don't
there's that
blame.
intimidation to want to walk up to your boss and be like, "Sir, please, does this company have a first aid box?
But I think sometimes because they don't
or
know,
do we own a
and
fire
you can't blame
extinguisher?"
every employee. And you know how our
don't
sector,
know?
huh?
Did you say you don't know?
If fire breaks out right
No,
now,
no, I'm not saying. I'm not saying. But some people, I think it doesn't occur to them that you'd want to ask if there is this or that. Look, one of our places, one of my working places back in the day. Look, I never knew the fire extinguisher was empty till a car caught fire downstairs. And you know, the one of the technician boldly walked into the studio, removed it as if Charlie, and everybody was like, yeah, he's got. The guy came on was blowing empty air.
nothing.
It was just black, and people were telling him that.
Asa,
There's nothing. He said, "No, it's coming. It's coming." Wait,
It's coming from where?
I'm like, "Ah."
Yes. that's
Oh,
what I'm telling you.
come
A
on.
lot of these things are just there for show, and
accessories.
yes, and just to get inspectors off their backs.
Yeah.
Really. So when they come around, then we
God.
have it. You've seen it. So
But
now
but
you
I
can get out
think
of
but I
fire.
think I want to. I don't know which agency is responsible. I think it's something that has to be put in force where there is that regulatory body that monitors places of works if they have some of these things.
That's what I'm saying, Barry. It's not something you can have just one because
Right.
when you talk about fires,
Uh-huh.
you have the fire department here, the Ghana National Fire Service. This is the fire
Right,
service in Ghana. We call it service, not the department. So they regulate some of these things. So they come to check up some of these things. Now, if you have, say, something related to health,
Mm.
the safety measure you need to put it related to health.
Yeah.
Then you would have someone from the, Ghana Health Service.
Okay.
Do that.
Right.
Okay. So if you have an agency, an occupational safety and health agency, what it means is that you would need personalities or expertise from all these agencies coming together to form that agency,
Okay.
so that when there's something on health, you know someone that's going there. When it's something on fires, you have someone that is going there, because you don't have. But then when you have something on that relates to security as well, you have a personnel there. I don't know if you get me.
Right.
So in this instance, you have a collective of of experts that form some of these agencies, because
Right.
you don't want to have illiterates or civilians, they call us, walk into a military barracks and try to assess a gunshot wound or gun situation or
Yeah.
whatever safety situation that
Yeah.
has to do with police work or military work and everything. So yes, an agency is required, but it will take a lot. That would mean a lot of resources. But sometimes, well, you could set them up and then they still tell you that, well, there isn't enough resources to run some of these things. And just what I've mentioned, it means you need not just the human personnel, you're talking about logistics as well. Yes, and the gadgets to run some
Wow.
of these systems anyway.
This is huge than it is, on a sheet of paper. But let me just take our final take by my mate, so we can just run up.
Yeah. So, according to the Labor Act of 2003, which is Act 651,
Right.
it is obligatory on every employer to ensure health, safety, and welfare of persons at workplace
Right.
by minimizing the cause of hazards inherent in the working environment. And this is the Labor Act that is operating here in our base, Ghana.
Okay.
So employers must ensure careful and safe use, handling, storage, and transport of articles and substances, and provide the necessary information, instructions, training, and supervision as needed.
Okay.
They must also take measures to prevent contamination of the workplaces and protect the workers from toxic gases, noxious substances, vapors, dust, fumes, mists, and other substances or materials that are hazardous to safety or health.
Okay.
They must also provide separate and sufficient and suitable toilet
Mm-hmm.
and washing facilities and adequate facilities for the storage, changing, drying, and cleansing from contamination of clothing for male and female workers.
Right.
There's also supposed to be adequate supply of clean drinking water be provided at the workplace. Now, if an employer fails to comply with the required health and safety standards, he or she is liable to a fine of maximum 1,000 penalty units, or to imprisonment of 3 years maximum, or to both.
Really?
I think I don't think most of us know.
No, we
this.
don't. Why would he? The question he would ask you is, why would he provide water for you? Can't you buy water by yourself?
You know what access you can have.
So you'd rather not go there.
And I think I
Right.
don't know if I think one of the things that is also a problem is I don't think there are health and safety workers who go around to check if officers have these things.
Nah, that was what Hafiz was saying, talking about costs involved and what have
Every
you.
department
But I
has.
think
Yes, but
No,
to
I'm
have
not talking.
a
I'm talking
bigger
about like
body.
on the a bigger body, like on the part of the government.
Governments.
Because if there's a labor act,
Mhm.
then there should be
There
people
should
who are
be, yeah,
checking
there
to
should
see
be.
that this act is being
there
acted
should be.
upon.
There should be.
We have very nice laws here. Implementation has always been a problem. Okay.
Well, that is
even,
true.
even in sanitation, I think back in the day we have these had
Isn't it
these inspectors.
Town council?
They call them sama or something.
Sama
Yes,
sama, yeah.
town,
That's-
it's the town council, and then as
Yeah.
as
Where are
Canadian
they?
as we are, we call
I
it
don't know.
town
the
council.
guys, the guy.
People didn't even like them.
In as much as people didn't like those people back then, I think they
They
were
were
really
doing a lot.
working.
Yeah, they were
Exactly,
doing
you
good.
see.
Yeah.
They were their best.
Yeah.
But they were
Because
doing their job.
they would ensure that at least you
Because
come out
if
and
that
clean.
thing
You know.
continued, then we wouldn't have this refuse problem that we have that Zoom Lion is trying to clean up.
Now the thing is, when they
taking a lot of
visit your
money.
house, the last time I saw them, when they visit your house, they just come sit down, have a conversation, and so it's okay. When you
Oh,
sweep
from a
here.
distance, someone will come and tell you that look, these guys are coming. You have people, carry their garbage into their
To
rooms.
their rooms.
And
Can you
But
imagine?
those people were actually working. If the
Oh,
government
yeah.
or anybody in the government is listening,
Sama.
they should
Please
bring
bring
that
them back. Yeah. And repackage them. Don't let them be walking around.
with
Very-
a vest. a
No, I'm
nice
serious.
vest.
No, I think the walking around is what helped. Because if they have a van and then they come in and they are
No,
announcing,
But the thing is, I'm saying not because they would have to move from house to house, walking, that's okay.
okay.
But the thing is, they will need a packaging, a car, a van, moving
Okay,
around.
okay, so
They-
it'll move to
different
community and
places,
then they
different
disperse.
exactly, so that
Okay,
they
I think-
disperse. When they're done, but then they move around. Someone just drops. Those are lights from the cab or public transport. They start entering people's house.
Information
I
will
don't
go
think it
around.
was like that.
I'm serious. Now,
I don't think it was like
it's
that.
just like, hey,
Actually, even with such workers, they need protection. I mean, how do you walk into someone that has a
Look.
wild dog?
Hafiz, let me tell you. Look, I have witnessed firsthand one being beaten. I'm telling you, it wasn't a joke. Yes, that guy was beaten and he had to run for his life. Later, the house had to be sued and oh goodness, man.
So even the lives of the health and safety inspectors.
At risk.
But we actually need them back.
Oh,
because
yeah.
they
They need
help
safety.
a lot.
Oh yeah. They need safety,
They need
exactly.
safety.
You know, and there was this guy who recommended that look, they should be working with policemen. Oh yes, and I think it's a good idea because when they see they feel these guys are harmless. They just come into
I think if,
and then go away.
making them work, they should.
And you make a
teach
mistake
them
and give the
defense
house a letter.
mechanisms.
A summoning letter. You make a mistake and write.
Isn't that? I mean, why can't we make something less labor intensive? Okay, do we have to have people walking around before they
But
do?
how would you inspect?
Isn't there a
it?
system where we could actually have the data of people and then find them?
The
How
issue
do
of
you
you
find them?
yourself? You know
No,
that.
people-
People don't
But you
exactly
see-
like their.
You see, we
was
always
talking about
talk,
a
we
future
always
Ghana.
champion.
That's
Look,
Ghana.
we
No,
that's
always
why-
champion the very best.
That's
of
why we are
what-
talking about this digitization of everything that.
But
we
I
have.
think so far we are doing we're gradually
Exactly.
getting there.
So you don't have people running around coming to your homes and you have to lock your doors and sound the alarm
Hafiz,
bell. So when they are
Even when
approaching your house.
census is happening in this country, people still move around to count.
Exactly.
Yeah.
Me, you're talking about a future Ghana, but this present one.
Well, but you're here, so you can make that change.
Yeah, I mean,
Yeah.
it
But you
is all
see,
dependent on us.
The whole thing
make
is
the
But the
change.
future starts now.
it's
so
eh?
it's never too late to
We're
start.
still looking at
Sorry,
tomorrow.
said,
All right, thank you very much, guys, for joining me on the discussion zone. And of course, very interesting and enlightening one. I hope you had a wonderful time. Well, if you have anything to join or share, please do so through our Facebook page, Africa Global Radio.